Although the risk is low, you can get a sexually transmitted infection (STI), often used instead of a sexually transmitted disease (STD), from kissing. Herpes, cytomegalovirus (CMV), human papillomavirus (HPV), and syphilis may spread through active lesions, that is, cold sores or saliva. In contrast, you cannot get STIs like chlamydia, hepatitis, human immunodeficiency virus (HIV), or trichomoniasis from kissing. There are STIs that can be spread through non-sexual contact that are also spread through sexual contact. Still, kissing is generally a low-risk activity compared to anal, oral, and vaginal sex. This is definitely a possibility, and there are some STIs that we worry about more than others when it comes to kissing, Michael Angerone, an associate professor of infectious diseases at the Northwestern Feinberg School of Medicine, told Health. Choose similar viruses: herpes simplex virus type 1 HSV1 and herpes simplex virus type 2 HSV2 cause herpes. You may contract herpes through skin-to-skin contact, such as during anal, oral, or vaginal sex, and while kissing. Planned Parenthood. Oral and genital herpes. Most people contract HSV1 by age 20. HSV1 typically causes cold sores or fever blisters on your gums, lips, mouth, or throat, also known as oral herpes. Cold sores may be red or yellow and crusty. They may break open and leak a clear or yellow fluid. You may have many small cold sores that grow into one large cold sore. Burning, itching, or tingling near your lips or mouth. Fever. Pain while swallowing. Sore throat. Swollen glands. HSV2 typically causes genital herpes, but may cause cold sores around or on your mouth if you practice oral sex. You may then spread HSV2 through mouth-to-mouth contact. MV is a herpes virus that may spread through saliva while kissing. About 50% to 80% of people in the United States have CMV. By age 40.5, many people with CMV do not know they have the infection since CMV often causes no symptoms. CMV sometimes causes flu-related symptoms like fatigue, fever, loss of appetite, malaise or generally feeling unwell, muscle aches, rash, sore throat, swollen glands. HPV. There are over 200 types of HPV, some of which spread through deep tongue kissing and oral sex. Oral HPV often causes no symptoms, so many people do not know they have the infection. As a result, oral HPV may easily pass from person to person. HPV may cause oral cancer in some people. Syphilis. Syphilis is spread by direct contact with a sore, typically found on or around the anus, lips, mouth, penis, rectum, or vagina. Syphilis symptoms may include 8. A skin rash. Fever. Firm, round, and painless sores at the infection site. Swollen lymph nodes. Gonorrhea is a common STI among adolescents. 9. Gonorrhea typically spreads through unprotected anal, oral, or vaginal sex and may transmit from mother to fetus during pregnancy. You may contract gonorrhea if you touch your eyes with infected fluids. Research has found that oral gonorrhea might spread through kissing. Oral gonorrhea usually does not cause symptoms, and most cases subside within 7 days. Some STIs do not transmit through casual contact, including kissing, such as chlamydia. The bacteria Chlamydia trachomatis causes this common ST. You may contract chlamydia through unprotected anal, oral, or vaginal sex. Pre-ejaculatory fluids, semen, and vaginal fluids may carry C. trachomatis. You may contract chlamydia if you touch your eyes with infected fluids. Chlamydia may spread from mother to fetus during pregnancy. Hepatitis. This causes inflammation of your liver. There are several types of hepatitis, such as hepatitis B and D, which may spread through unprotected sexual contact. Saliva does not carry hepatitis B, so you cannot contract it through kissing. You also cannot get hepatitis D through kissing. Human immunodeficiency virus (HIV). This virus may spread through blood, breast milk, rectal fluids, pre-ejaculatory fluids, semen, and vaginal fluids. You may contract HIV by having unprotected anal or vaginal sex or sharing drug paraphernalia like needles. HIV does not spread through saliva, sweat, or urine. Rarely does HIV spread through kissing if both people have bleeding gums or sores. Trichomoniasis, pre-ejaculatory fluids, semen, and vaginal fluids may carry the parasite that causes trichomoniasis, or trich. Trich often spreads through unprotected vaginal sex and vulva-to-vulva contact. You may also contract trich by touching your eyes or using sex toys with infected fluids. Treatment depends on the cause of oral STIs. For example, cold sores caused by oral herpes often go away on their own within 1 to 2 weeks. At-home treatments that may help reduce symptoms include applying ice or a warm washcloth to the affected area to alleviate pain, cleansing cold sores with antiseptic soap and water, eating fruit-flavored popsicles, gargling cool water or rinsing with salt water, not consuming citrus, hot drinks, or salty and spicy foods, using Tylenol, acetaminophen, to reduce pain. You may take antiviral medicines, including acyclovir, famciclovir, and valacyclovir, to reduce the frequency of cold sore outbreaks. Still, oral herpes is a chronic infection, so antivirals cannot cure it. You may need to take antivirals continuously if you often get cold sores. Like oral herpes, CMV and oral HPV often resolve without medicine. 64. You may take pain relievers or gargle salt water to help treat CMV. People with weak immune systems may require antibody therapy or antivirals. Penicillin, an antibiotic, helps treat syphilis. You may take doxycycline if you are allergic to penicillin. Preventing oral STIs may be difficult. People are often unlikely to ask for someone's complete sexual history before the first kiss. Still, healthcare providers say there are a few ways to lower your risk, such as ask questions. Kissing tends to happen spontaneously, and it's unlikely that you'll have a conversation about sexual history before kissing someone. Still, it's more than okay to ask about and be open about sexual health before you kiss someone. Do not kiss someone with a cold sore. You are less likely to contract herpes or syphilis if someone does not have an outbreak than if they have an active lesion.